Hey everyone, it's me, Andrew. Welcome back to my channel. So today I'm going to be talking about my top surgery appointment, which I'm so excited to talk about. The reason why I haven't been able to record it until now is because my mum and I swapped bedrooms, and my old one was bigger than hers, and not only because she's my mum, but I felt it was just really unfair because I didn't really need that much space, and I felt like I really don't need a bigger room. So we swapped rooms. There's a new carpet. There's still stuff that needs to be delivered to my house for hers in my bedroom. So my room is a tip at the moment, and my mum and I wouldn't really be happy showing my messy room. My mum will definitely not be happy about it. So it was a bit of a struggle trying to find my tripod because I somehow put it at the back of a room, or actually the back of the hallway. I don't know why I did that. Wow. So top surgery appointment. I spoke to this lovely lady, and for me to warm up to her and for her to get to know me a bit more, she asked me a bunch of questions, mostly about transitioning, about when I started, when I legally changed my name, and transitioning through work and stuff like that, and yeah, so after that, and we talked a bit about family as well, and mental health, and she asked me all these questions because she wanted to see if I was eligible for top surgery. She did say to me if I wanted to know why she's asking me these questions, I can ask her, because there's obviously a reason, and I was like, nah, it's fine. I mean, it's another doctor, and I've waited for this top surgery appointment, I'm not going to withhold like important and vital information. So I was like, I'm not really fussed, but you have to ask these questions for a reason. So, not like she has her own agenda of asking them about it. After that, she asked me how I felt about my chest. Because it was a top surgery appointment, I realized before making this video and the other one about this appointment, I haven't really spoken about my chest and how I feel about it. Disclaimer: if you feel like you're gonna feel really uncomfortable and uneasy and upset, please skip ahead of this video. Until, I don't know, I wave my hands or something, I don't know. So yes, so how I feel about my chest, it's really on and off, because I've kind of like learnt, or I've trained my, I don't know, I've taught myself to ignore my chest, and it was just awful. It's awful every time when it's summer, because loads of sweat, and it's just like I felt very uncomfortable, and I was just kind of like, I really don't like binding, but I need to bind so I can feel comfortable with myself, and just like stuff like that, and I feel really self-conscious about my chest, especially when I'm at work and I'm stealth at work. So it's just sometimes it's just like it's just a struggle. It's just a struggle to bind, and I really want to have top surgery, and I hate binding, and I don't like my chest either. Anyway, I stopped talking about it. Wait a minute, yes, I stopped talking about my chest, so you can carry on watching, thank you. And thank you for whoever carried on actually watching that. So yes, so after that we touched upon genital surgery, bottom surgery, and I told her again with how I feel about my chest. It's all a bit touch and go. Once again, I'm kind of going to talk about my junk, so exit this video or watch until I wave my hands frantically like this again. It's touch and go, because I suppose I have more dysphoria downstairs than upstairs than on my chest. I was considering it for a long time, and it wasn't until recently that maybe yes or no sort of thing has turned to a yes, because I'd love to have bottom surgery. I'll probably talk more about it in future videos, just not that much now because this is about my top surgery, so look forward to that. I don't know, but talking about my junk as well, like my downstairs, it's also really personal, so I probably will withhold some information and some of my feelings or something, but that's how I feel about it, because I really want bottom surgery as well. I stopped talking about my junk. And then she asked me what surgeon I have in mind. Thank you to the lovely person who told me that I should really look into surgeons. I picked a surgeon, the one in Brighton, because I leaned towards him when I done my research more, because I mean there was other surgeons in London and I thought that's very convenient, but I felt like this disconnection between me and some. I mean, this is first impressions on looking on their website, so I'm not trying to be like, I don't have a personal thing against them or anything, but the reason why I went to I picked a surgeon that's in Brighton is because he has pictures of pre-op and post-op pictures of his patients, and I was digging that a lot because it felt more personal, and you know, reading through his website about what what the precautions you have to take before you're on top surgery and stuff like that, and I felt more comfortable because first impressions and looking on other surgeon sites, surgeons who are based in London that can do top surgery, I felt this disconnection between me and them because I don't know, there was barely any personal, it wasn't personal, if that makes sense. I mean, it was, but I mean on a professional level, but it just, I don't know, yeah, that's how I felt. Yeah, I'm sorry. So my doctor said she said she's not sure how long the waiting time for this surgeon is, but she said that I totally should contact, and ask where I am on the waiting list to see him, and so my next appointment, I'm going to be talking to another the doctor who prescribed me on T about bottom surgery. She also mentioned that that doctor that prescribed me on T and herself, they're going to both be my signatures for my top surgery approval thing, which is awesome. And I was just kind of like, what do I do now about the top surgery? So she explained it to me that she's gonna write it down on the note, right? She's gonna include me in her notes, and my other doctor's gonna read it, and then he'll probably sign it, and then they're gonna write a letter or email to the surgeon in Brighton, and she said then he will contact me. Or, yes, I said this really slowly so I can make sure I said it right. But yes, so the surgeon will get back towards me, and I'm probably will be able to get a forwarding letter about my top surgery approval. So whenever that happens, and she did also mention that how the post will be there. How I said this really weird. How basically I won't have to wait that long for post, basically, because it's usually 3 months. So I'm hoping less than 3 months. I'm hoping for some forwarding letter. Anyway, I think I mentioned what I said I would talk about. If you feel like I've missed anything out, please comment. And if you want to talk about your experience before you had top surgery, or about top surgery, or just, I don't know, anything, please comment. I'd love to talk. Thank you so much for watching. I'll see you in the next video. Please take care of yourselves. Bye!